Hello everyone, welcome back to the channel. I'm really excited to take you through today's very important topic, integrated management of neonatal and childhood illness, or IMNCI. Now, before we dive in, let me ask you, have you ever seen a sick child under 5 years old and wondered, where do I even begin? What if I miss something important? Well, IMNCI is the answer. By the end of this session, you will be able to confidently assess, classify, and manage common childhood illnesses step by step without overlooking any major danger signs. Stay tuned until the end because I'll also give you patient scenarios plus an interactive quiz to test your knowledge. So, what is IMNCI? This is a systematic approach to child health that is both curative and preventive. It was developed by the World Health Organization and UNICEF in 1992. It integrates technical guidelines for the management of specific diseases in sick children under 5 years, while focusing on the whole child, not just one symptom. Think of it this way. Instead of only looking at the cough or the diarrhea, IMNCI teaches us to step back and look at the entire child, their breathing, feeding, danger signs, hydration, and more. There are 6 key modules of IMNCI. There is assess and classify a sick child aged 2 months up to 5 years, identify treatment, treat the child, counsel the caretaker, manage the sick young infant, and follow up. So today our focus is on module 1, assess and classify, because if we don't assess well, treatment may go wrong. Okay, so looking at the first step, which is assess and classify. So when a mother brings a child, first ask, what are the child's problems? Is this an initial visit or a follow-up? If it's a follow-up, use the treat the child chart. If it's an initial visit, begin full assessment. Okay, so when doing a full assessment, you need to check for the general danger signs. So you need to ask the mother if the child can be able to drink or breastfeed, because if not, it may mean severe dehydration, severe pneumonia, or central nervous system problems. You can also ask if the child is vomiting everything. This may indicate obstruction, meningitis, or severe infection. Also ask if the child has had any convulsions. Convulsions may point to central nervous system infections, high fever, or epilepsy. Okay, apart from asking, you can also look for signs of lethargic or unconsciousness. This means there is severe hypoxia, hypoglycemia, or sepsis. So if there is any of these danger signs, it means this is a severe classification and it requires urgent care and referral. Okay, you also check for cough or difficult breathing. So a child with a cough or difficult breathing may have pneumonia or bronchitis. Now, pneumonia, this is a bacterial infection of the lungs, and there is fast breathing and chest injury. Bronchitis is usually or most commonly caused by viral infections. There is mild cough and no antibiotics are needed. So when it comes to assessment, you need to ask, does the child have a cough or difficult breathing? If yes, ask, for how long? If that cough is more than 3 weeks, that means it is a chronic cough. So you need to think of TB, asthma, or whooping cough. Then look for fast breathing, chest injury, wheezing or stridor, in a calm child. So what is the cutoff for fast breathing? So for you to say a child has fast breathing, a child between 2 months to 12 months, they need to have more than 50 breaths per minute. Then a child 12 months to 5 years, they need to have more than 40 breaths per minute. Okay, having discussed the danger signs and cough or difficulty breathing, let's now look at the classification of illness. And the first classification that we're going to look at is severe pneumonia or very serious disease. So we can classify this one if there is any danger sign or chest injury or stridor in a calm child. So the nursing intervention is to clear the blocked nose with a syringe, keep the infant dry and warm, and also give paracetamol if the temperature is 38.5 degrees Celsius or more. We can also give fluids. Now, to avoid overload, for children below 12 months, we give 5 ml per kg per hour. Then for children 12 months to 5 years, we give 3 to 4 ml per kg per hour. So the total that we give in 24 hours is 72 to 96 ml per kg. Okay. Then when it comes to feeding, you need to encourage breastfeeding. If unable, express milk and feed with spoon or dropper. You can also give antibiotics. So if there is mild injury, you can give oral cotrimoxazole. If at all it is severe, you can give IM penicillin or chloramphenicol IM as well. The alternatives antibiotics that you can give are the cephalosporins. Okay, now let's look at this patient scenario. A 10-month-old infant is brought in with cough, fever, lethargy, and chest injury. The child cannot breastfeed. What do you classify? Okay, so think about it before I give you the answer. Okay, so if you're thinking severe pneumonia or very serious disease, you're correct. So that means this needs urgent antibiotics and fluids. So the second classification that we're going to look at is pneumonia. So pneumonia is defined by fast breathing only. So treatment is amoxicillin or cotrimoxazole for 5 days and then review after 2 days. Okay, so here's another patient scenario. So a 3-year-old has cough for 2 days, 42 breaths per minute, and no chest injury. So from this scenario, what you are going to notice is that first of all, the cough is less than 3 weeks. Then there is fast breathing, and there is no chest injury. Therefore, since we said pneumonia is defined by fast breathing only, in this child there's only fast breathing. Therefore, the answer is pneumonia. The child only needs antibiotics and then to be reviewed in 2 days. Okay, the third classification is no pneumonia, so which is just cough or cold. So in this classification, there is no severe signs. So the management, you just need to advise the caretaker on self remedies for cough, then review after 5 days. However, if the cough is more than 3 weeks, you need to reassess the child for TB or asthma. Okay, so another patient scenario. A 2-year-old has coughed for 4 days, 32 breaths per minute, alert, and breastfeeding well. So when you look at this scenario, there are no danger signs. Okay, first of all, the breaths per minute, they're just within the normal ranges. This child is alert. This child is breastfeeding, well, meaning there's no dehydration. Therefore, this is just a cold. Okay, you can just say it's just a cold. Therefore, no antibiotics are needed. And you can also notice that this cough is only for 4 days. Therefore, if this cough was more than 3 weeks, then we can reassess for TB or asthma. Okay, now let's look at the classification chart. So the chart uses colors. The pink row meaning that is severe. Okay, so that should be very severe disease or severe pneumonia. So for a child to be classified in this pink row, it means there should be any danger sign or stridor in a calm child. Okay, so the action is you need to give the first dose of an appropriate antibiotic and then refer that child urgently to the hospital or inpatient. Okay, then the yellow row needs it means that the child needs specific treatment. Okay, so in this one it means the child has chest injury or fast breathing. So the interventions are the things that we've already discussed. Then the green row, that means no specific medical treatment is needed. Okay, it means in this child there are no signs of pneumonia or very serious disease. Okay, now it's time to test your knowledge. So question 1, a 7-month-old with cough, chest injury and fever 39 degrees Celsius, what's the classification? So we have A, pneumonia, B, severe pneumonia, C, cold. So the answer to this one is B, severe pneumonia. Why? Because there's chest injury, which is a severe sign, and the child needs, of course, antibiotics, fluids, warmth, and we need to refer this child. Question 2. A 4-year-old with 41 breaths per minute, no chest injury, what is the classification? So there is A, pneumonia, B, cold, C, severe pneumonia. Okay, so the answer to this is pneumonia. Okay, why? Because from this child there is only fast breathing, and the cutoff fast breathing for a 4-year-old, we said it is 40 breaths per minute or more. Therefore, this is pneumonia. Okay, another question. A child has cough for 25 days, no fever, no injury. What next? So A, reassure caretaker. B, give antibiotics. C, reassess for TB or asthma. So what's the answer? Okay, so the answer is C, reassess for TB or asthma. Why? Because this is a chronic cough, and we said that it is a chronic cough if it is above or if it is more than 3 weeks. Therefore, we need further evaluation for this child. That's it for today's deep dive into IMNCI assessment and classification of cough or difficulty breathing. We learned how to check danger signs, classify pneumonia, and manage children with appropriate drugs and care. If you found this helpful, please like this video, drop your questions in the comments, and subscribe for more educational content. Remember, Every time you use IMNCI, you are not just treating a symptom, you're saving a child's life. Thank you for watching and see you in the next video.